tired of always guessing when your next period will come or when you're most likely to get pregnant? Most women don't know how to properly calculate their menstrual cycle, so they miss their fertile window every single month, and some even end up with unplanned pregnancies. Now, I know some of you have already given up on this menstrual cycle calculation because of how confusing it can be. Some of you even say to yourself, no matter how they teach this thing, I will not understand it. But trust me, after watching this video, you will understand it better and be a pro at it. You will even be the one teaching others. All you have to do now is get your calendar and your pen, then you are good to go. I am Nurse Sandra. I am a registered nurse and midwife with a BNSC degree. On this channel, we talk about understanding your body, your health, and your fertility. And today, I'll show you step by step how to calculate your cycle like a pro and know your exact fertile days to get pregnant, as if you're trying to conceive, and also your safe days to avoid pregnancy. So just grab your calendar and your pen, mark your last period date, because after this video, you will never be confused again. Now, for you to know your fertile window and your safe days, first, you need to understand what a menstrual cycle actually is. Your menstrual cycle is the number of days from the first day you see your period, not the first day you saw brown spotting or brown discharge, but the first day you see real bleeding. So the day before your next period begins. That is your menstrual cycle. Let me just show you on the board so you understand what I'm saying better. So we're going to assume that this is our July calendar. So if your period started on the 2nd of July, so let's say this is the first day your period started, and the next time you saw your period again was 31st of July. So this is a 29-day cycle length. Now, how did we get 29? This is the first day your period started. That's going to be your day one. Day one. And let's assume the period lasted for 4 days. Day 2, day 3, and day 4. This is not your cycle length. This is just the number of days your period lasted for. A lot of women make this confusion. Sometimes in the hospital, when you ask them, what is your cycle length? They'll tell you 3 days, 4 days, or 5 days, or even 7 days. No, that is not your cycle length. Your cycle length is the number of days from the first day you see your period, which is this day 1, to the day before your next period begins. Now, let's count. So this is day 1, the first day your period started, day 2, day 3, day 4, day 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, day 20, day 21, day 22, day 23, day 24, day 25, day 26, day 27, day 28, day 29. So this is a 29-day cycle length. So it's the number of days from the first day you see your period to the day before your next period begins. That is your cycle length. So this is a 29-day cycle length. 29 days cycle length. I believe you now understand what your cycle length is. Now, one thing I want you to know is that cycle length varies from woman to woman. Some women have a 21-day cycle length, 25-day cycle length, 30-day cycle length. So every woman does not have a 28-day cycle length like most women assume. So if you have a 21-day cycle, a 25, 26, 27, 28, up to 35-day cycle, it is considered normal. It's only when it's less than 21 days or greater than 35 days that is considered abnormal. That means you need to see your doctor to know why it's like that. Mind you, there are several factors that can affect your cycle length to either make it longer or shorter. So like I said earlier, the normal cycle length is between 21 days and 35 days. When it's below 21 or above 35, that means there is a cause for concern. I'll take it that you now understand what your cycle length is and how to calculate your cycle length. Before we go to the next one, which is how to calculate your ovulation and know when you're ovulating, I'd like it to be in the comment section for me to be sure that you really understand what I've been explaining so far. So type the first day you saw your period in July and the next date you saw it. Then tell me what your cycle length is. After you've done that, don't send it yet. Just hold on till we finish calculating ovulation. Then you're going to include it and send everything at the same time. I just want to be sure that everything I've explained so far, you understand very well. And if there are any corrections, I'm willing to do that corrections with you in the comments. And also, don't forget to like and subscribe. So the next thing we're going to be looking at now is how to calculate your ovulation day. Ovulation usually happens 14 days before your next period begins. And it's not the middle of your cycle or day 14 of your cycle like most women assume. It's 14 days before your next period. Now, the easiest way for you to calculate your ovulation is to see 14 as a constant number. Whatever your cycle length is, be it 21, 25, 35, all you have to do is subtract 14 from your cycle length. So for this, our 29-day cycle length, all we have to do to get our ovulation day is to subtract 14. So no matter what your ovulation day is, just subtract 14. So what we're going to get is 15. So this means that for this 29-day cycle length, ovulation is going to happen on day 15. So we're going to count from day 1, day 2, day 3, day 4, day 5, day 6, day 7, day 8, day 9, day 10, day 11, day 12, day 13, day 14, day 15. That's on the 16th of July. This is when this person is likely going to get her ovulation. 16th of July, which is day 15. So that is how you calculate your ovulation. Now, let's say you have a 25-day cycle. All you have to do is, 25-day cycle, all you have to do is subtract 14 and you get 11. So that means for a 25-day cycle, your ovulation day is going to be on day 11, which is on the 12th of July. No matter what your cycle length is, be it 30, 35, 24, whatever it is, just subtract 14, then you get your ovulation day. So that is how you do it for each of your cycle. Now, in case you don't know what ovulation is the day your ovary releases an egg, and it's the most fertile day in your cycle. This is when you have a higher chances of getting pregnant. Now, back to your comments. Since you already have your cycle length there, subtract 14 and tell me when you are ovulating. We are not done yet. We still have other steps to cover. Let me just give a quick recap. So like I said earlier, no matter what your cycle length is, be it 29, 28, 26, 30, 35, no matter what it is, all you have to do is subtract 14. Then you get your ovulation day. Now, this is one part I need you to pay close attention to. Ovulation day is not always precise. You can't just say, now I have calculated and I know I'm going to ovulate on the 15th. And you dwell on that. No. This calculation just gives you an estimated day of ovulation. It gives you an idea of when you're going to ovulate. So it's not always guaranteed. To be on the safer side, we use the plus and minus 2 method. Now, how do you do this? After you've gotten your estimated day of ovulation, what you do is add 2 days to the day of ovulation and minus 2 days. Now, for this, our 29-day cycle length, since we've already calculated ovulation to happen on day 15 of our cycle, what we're going to do now is use the plus or minus 2 method. Now, the plus or minus 2, if we minus 2 from 15, it will give us day 13 and day 14. This means that the woman can either ovulate on day 13 of her cycle, day 14, or day 15 of her cycle. Now, if we add 2 to 15, that will give us day 16 and day 17. So this means that the woman can either ovulate on day 15 of her cycle, which is her ovulation day, day 16, or day 17. So altogether, using the plus or minus 2 method means that the woman can either ovulate on day 13 of her cycle, day 14, day 15, day 16, or day 17. So this is how you should be calculating your ovulation. This plus and minus 2 method will save you a lot of stress, trust me. Now, another important thing I want you to note is that sperm can survive in the female reproductive tract for up to 5 days. That means if you had unprotected sexual intercourse 3 days ago, sperm will still be in your body today and tomorrow. So even though you had sexual intercourse 3 days ago and you ovulate today, you could still get pregnant. Since sperm can stay in the female body for up to 5 days, To calculate your fertile window, what you need to do is pick the earliest day the woman can ovulate, which is on day 13. You add 5 days to this. Let me just clean this part so we'll get it clear. For this 29-day cycle, the days she can ovulate are day 13, 14, 15, day 16, and day 17. So what you do now is add 5 days to it plus 5. Now, because ovulation day is not always precise and we can't say for sure when this woman is going to ovulate, and for instance, ovulation happens on day 13. If she has sexual intercourse 5 days before day 13, that means she can still get pregnant. So what you do is count 5 days backwards from 13. So this is day 13. This is 1, 2, 3, 4, 5. So if this woman has sexual intercourse from day 9, she could still get pregnant if ovulation happens on day 13. And if she has intercourse on day 11 and ovulation happened on this day 16, she could still get pregnant because the sperm is already in the body waiting for the egg to be released. And once the egg is released, the fastest sperm swims to the egg to fertilize it. So for this 29-day cycle, our fertile window is from day 9, day 10, day 11, day 12, day 13, day 14, day 15, day 16, and day 17. So these days are a fertile window. These are the days you have higher chances of conception. So if you are trying to get pregnant, these are the days you should be having sexual intercourse. And if you're trying to avoid pregnancy, these are the days you should avoid intercourse. You can have sex any other day aside these days. Now, just a little recap about this fertile window. Like I said earlier, sperm can survive in a woman's body for up to 5 days. Now, because sperm can survive in a woman's body for 5 days, you pick the earliest date you can ovulate from your plus and minus 2 method. You pick the earliest date. Now, for this 29-day cycle, our earliest date she can ovulate is 13th. Now, we are counting back because if you have unprotected sexual intercourse 5 days before this day 13, there's every possibility that she can get pregnant. So we'll just pick our earliest date, which is on day 13. So you count backwards 1, 2, 3, 4, 5. From this day 9, if she has sexual intercourse and she happens to ovulate on day 13, she could get pregnant. Or if she has sexual intercourse on day 11 and she happens to ovulate on day 15, she could get pregnant. This is how you calculate your fertile window. So I believe you now understand how to calculate your fertile window. Now go back to your comments, add your fertile window to your calculation. Let me see if you got it right. And I'll be so happy to see this comment, honestly. Please, if you're finding this video helpful so far, don't forget to hit on the like and subscribe button. Also share so other women out there will get to see the video and learn from it. So we have basically covered how to calculate your menstrual cycle length, how to calculate ovulation, how to use the plus and minus 2 method, and how to calculate your fertile window or your fertile period. Let's calculate for another cycle so you understand better. So like I said earlier, let's calculate for another cycle. A little recap about everything I've explained so far. So let's assume you saw your period on the 3rd. So this is going to be your day 1. And the next time you saw it would be maybe 29th. Next time you saw your period will be 29th of July. We're going to assume it lasted for 3 days. This is day 1, day 2, day 3. So we're not going to stop counting from there. Since we're trying to get the cycle length of this person, we're going to continue counting. So it's going to be day 1, day 2, day 3, day 4, day 5, day 6, day 7, day 8, day 9, day 10, day 11, day 12, day 13, day 14, day 15, day 16, day 17, day 18, day 19, day 20, 21, 22, 23, 24, 25, 26. So this person has a 26-day cycle. So your menstrual cycle length is the number of days from the first day you saw your period to the day before your next period begins. So that is your menstrual cycle length. Now let's calculate our ovulation day. Now what we're going to do is subtract 14 from 26. This is our cycle length. So I'm just going to subtract 14. I've told us that we should learn to see this 14 as a constant number. So we're going to get 12. 12. So day 12 is going to be our ovulation day. So this is day 12. This day 12 is going to be our ovulation day. We're going to use the plus and minus 2 method, which means that she can either ovulate on day 10 or day 11. Then the plus 2 method, she's either going to ovulate on day 13 or day 14. So for this 26-day cycle length, our ovulation is either going to happen on day 10, day 11, day 12, day 13, or day 14. So this is how you calculate your ovulation. Now, since we've gotten the ovulation days, I will know that sperm can survive in the body for up to 5 days. What we're going to do is take the earliest day she can ovulate. Our plus 2 or minus 2 method, she's either going to ovulate on day 10, day 11, day 12, day 13, or day 14. So the earliest day she can ovulate is day 10. So if she has sex 5 days before this day 10, she's likely going to get pregnant. What we'll do is count 5 days back. This is 1, 2, 3, 4, 5. So these 9 days are her fertile window. This day 6, day 7, day 8, day 9, day 10, day 11, day 12, day 13, and day 14. This is a fertile window. So these are the days that you have higher chances of conception. So if you are trying to get pregnant, these are the days you should be having unprotected sexual intercourse. And if you're trying to avoid pregnancy, avoid these days, but you can have sexual intercourse on any other days aside these days. With this example, I believe you now understand how to calculate your menstrual cycle length, your ovulation with the plus and minus 2 method, and your fertile window. So I usually get questions like this. How do I start counting my menstrual cycle since my period usually start as 14? So like I explained earlier, you start counting from the day you see re-bleeding, not your brown discharge or spotting. From the day the re-bleeding starts, that's when you start counting. Then another question I often get is, what if I have irregular cycle? How do I count? If you have irregular cycle and you want me to make a video for you, just let me know in the comment section so I can make a video for you on how you can calculate in the simplest form ever. As a woman, understanding your cycle is very important. It gives you power. Whether you're trying to conceive or trying to avoid pregnancy naturally, it gives you an edge over these things. So it's very important for you to know how to calculate your cycle so you can work your way around it all. Don't forget to drop your comment on how you calculated your menstrual cycle, your ovulation, and your fertile window. If this video has helped you, if you learned something from this video, please don't forget to hit the like and subscribe button. Also share this video to as many women you know so they'll get to watch the video and learn from it. And always remember, your health is your wealth. Little changes makes a big difference. Thank you for watching, and I'll see you in my next video. Bye.